Hey, I'm Dr. Brett Raynor, orthopedic surgeon here at Texas Orthopedic Associates in Dallas, Texas. So rotator cuff tears in the shoulder are very common. We have 4 tendons in the shoulder that kind of are deep down underneath the shoulder muscle that help initiate motion when we move our arm. And there are 4 of them, and the top one is usually the one that's involved. It's called the supraspinatus tendon. It's very common to have tears in these tendons, and there are actually millions of Americans walking around with tears in their rotator cuff that don't know it. But sometimes they become painful, and sometimes they cause weakness when they're torn because you can't raise your arm up enough. And so we initially try to get these better without surgery, but sometimes they don't get better without surgery, in which case we need to go and repair that tendon back down to the bone and hold it there so that it will grow back down into the bone so that it can better raise the shoulder without pain, and it also helps stabilize the shoulder as well.